Iron is a mineral and a crucial component of numerous proteins such as hemoglobin, myoglobin, and enzymes in mitochondria for ATP generation. Iron intake is usually equal to iron loss. Iron stores are replenished as dead RBCs release their content and iron is recycled. Iron is taken in diet from animal and plant sources. On the other hand, iron loss is observed in three basic ways. First of all, iron moves out of the body without getting absorbed from gastrointestinal tract. Secondly, sweating plays a significant role in loss of iron. Additionally, shedded skin cells are also culprit for the loss of iron. Iron exists in two forms. First one is heme iron. Heme iron is obtained from animal sources like meat. It exists in ferrous form, that is Fe2 positive, and it is the form of iron which bonds to body proteins. Second form of iron is non-heme iron, which is obtained from plant sources such as spinach and beans. It exists in ferric form, that is Fa3 positive. Additionally, it stays unbound or free. Let's hover over to see how iron absorbs, how it is transported and stored inside the body. Most of the absorption of iron occurs in the duodenum and the proximal jejunum of the digestive system. Intestinal cells can easily incorporate heme iron, which is said to be absorbable form of iron, while insoluble or non-heme iron is converted into heme iron via acidic pH of stomach, which activates ferric reductase enzyme for conversion of ferric form into ferrous form. This Fe2 positive then binds with ferritin protein to get stored inside the cell. For transporting iron to blood vessel from stored area, it should leave ferritin behind, which means ferrous or heme iron will enter capillary and will be oxidized into ferric or non-heme iron by courtesy of hephaestin or ceruloplasmin. Fe3 positive will then bind with transferrin protein. Now we will look forward towards cause. Iron deficiency can be due to decreased iron intake, decreased iron absorption, increased iron demand by the body, or increased iron loss. All these factors lead to insufficient iron body stores to meet the body demands. Let's begin with the decreased iron intake. This factor is most common and usually prominent in vegetarians who lack readily absorbable heme iron in their diet and hence face iron deficiency. This kind of iron deficiency occurs in infants with low iron content in breast milk. Next point is decreased iron absorption, which might be due to gastrectomy. It is surgery to remove part or whole stomach. If one part of stomach is removed, it is said to be partial gastrectomy. And in case of whole stomach removal, it is termed as total gastrectomy. Both these scenarios reduce stomach hydrochloric acid, which is needed for absorption of non-heme iron from gut. Additionally, inflammatory bowel disease or IBD, which include ulcerative colitis plus Crohn's disease and celiac disease, act as roadblocks in the way of iron absorption from gut. Further, increased iron demand can be due to rapid growth time frame as kids need more nutrition in their growing phase. There is also high need of iron during pregnancy. Increased loss of iron can be because of worms, typically hookworm, which sucks out the blood. Helicobacter pylori consumes iron from gut. Colon cancer promotes iron loss. Moreover, bleeding from heavy menstruation and gastric ulcers play a significant role in iron loss. All these factors lead to decreased hemoglobin levels. And as a result, there will be insufficient hemoglobin to entrap inside RBCs, leading to microcytic and hypochromic RBCs. Hence, reduction in number of RBCs will be seen and ultimately lack of oxygen transport causing hypoxia will be reported. In order to cope up with hypoxia, bone marrow starts producing RBCs of irregular size and shape in hurry, causing more trouble. Let's jump in to see what are the typical symptoms of this ailment. These include pale skin, fatigue, weakness, dyspnea, irregular heartbeat, feeling cold, headache, dizziness, and chest pain. Rare symptoms occur due to tissue iron deficiency, and these include bluish tint to sclera of eye, tongue atrophy, angular stomatitis, which is a condition that causes red swollen patches in the corners of your mouth where your lips meet and make an angle, koilonychia, which means spoon-shaped nails, and Plummer-Vinson syndrome, in which pharyngeal webs develop in long-standing deficiency and it becomes malignant. In the next video clip, we will throw light on diagnostic tools and treatment tactics. So stay tuned on sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.